Welcome back. According to the most recent data, more than 7 million Americans are currently living with Alzheimer's. And despite it being the most common type of dementia, the number of deaths from this disease over the past 2 decades has been increasing by more than 134%. The CDC also says nearly 40% of patients may have been able to delay or even prevent this disease. So certainly something that touches a lot of families, has a lot of high interest here. Joining me today, we have Dr. Ira Chang, a neurologist with HCA HealthONE Swedish. Thank you, Dr. Chang, for being in here today.
Thank you for having me.
These numbers are staggering, and I don't know a family at all who doesn't have some connection to Alzheimer's. And so I think let's maybe start with explaining the terms. I hear Alzheimer's, I hear dementia. I don't know if I really understand the difference between those two terms.
Sure. So dementia is a more overall terminology for people who have cognitive decline in multiple areas.
Kind of like an umbrella term?
Yes,
Sure.
right.
Okay.
And so Alzheimer's dementia probably is about 70% of patients who develop dementia, but there are other more common factors being such as vascular dementia, when people have decreased circulation or little strokes in the brain. And that, occurs with risk factors of diabetes, high blood pressure, obesity, and some genetics as well. And then other things like B12 deficiency, some are related to Parkinson's, possibly Lewy body dementia. So the treatments are different. So it is important to try and distinguish.
So many families have had to go through the process of figuring out, is something perhaps normal aging, or is there a sign of something else going on? So if you could be giving some advice to families who are kind of on the lookout, I don't want to just say a symptom list necessarily, but as you're really thinking about your loved one who might be showing some signs that are concerning, where would you even start with that?
So I think with normal aging, what we're finding out is that the axons, which are the nerves that connect different parts of the brain to each other to communicate, degenerate, as well as mitochondria, which is kind of like the battery or the energy cell of the brain. So as a result, with normal aging, things slow down. So it's harder to multitask. It's harder to retrieve words, gait, coordination, all those things are slower, but you can still learn new things. You can still multitask. It just takes a little longer. Maybe it takes longer to retrieve words or, run around on the tennis court or whatever it is. But with dementia and with Alzheimer's specifically, the nerve cells or the brain cells are degenerating. So it's going to be hard to do single tasks, even like putting your clothes on, putting your pants on. They're not going to be able to learn new things, to lose memory and function for things that they once knew, because they're just, really losing those thoughts and memories and functions.
Do you find families can sometimes confuse these two things?
Early on, I think it's very difficult, because, for instance, if you give someone a clue and say, oh, do you remember this or something, then people can usually retrieve it, whereas someone with dementia might never say, like, I don't know, it's not there.
It's worth a good conversation with a neurologist either way, right?
Absolutely.
Okay, let's talk about, you mentioned risk factors, and we'll get to prevention too, but I guess if there's something you're already dealing with medically, or you perhaps have something in your family, are those obvious risk factors for you if a patient comes in?
So there are some genetic risk factors. Certainly for Alzheimer's, there's some genetic predispositions, but doesn't necessarily make it hereditary. Of course,
That's interesting, because I've always heard it might be. Okay.
Hereditary meaning it's not going to be guaranteed that you're going to pass it along.
Okay.
It's just that you might have a predisposition toward it.
Okay.
With other environmental factors. And really, I think we're learning that the risks for developing dementia could also be, non-pharmacologic things like lack of sleep, for instance, especially in your 50s and 60s. When we sleep, we get rid of toxins from the nerve cell functions during the day and reset for the next day. Healthy eating, diet, of course, high blood pressure and glucose and cholesterol causing decreased circulation in the brain, nutritional deficiencies, so again, healthy diet and physical exercise, as well as mental interactions, so social interactions. And lack of social interactions, vision loss, hearing loss can all contribute to having a cognitive decline.
Well, many of the things you're saying here is risks are also things we can control. We can help ourselves a little bit. Some of these things we can control, right?
Absolutely.
Diet and sleep. I wish I could get more sleep myself. But, okay, in the final minute we have here, because we'll need to wrap up, just my last thing is, are you surprised, though, that deaths continue to increase, considering how much more we know now and how we have tools? We have tools.
Well, we do have treatments now to slow progression and sometimes even reverse the changes in the brain. But I think, number one, the population is growing and people are getting older, and people are still not getting diagnosed until they're in their 80s with dementia. And so I think the key is that it's important to get diagnosed and get treated early on, because we still have not been able to reverse the brain cell loss, but we can slow down progression.
Okay, Dr. Chang, thank you for all these really good pieces of information and giving families a little advice on what they can do with this. So thanks for coming in.
Thank you very much.
We're going
All
to
right.
take a quick break. We'll be right back.